And finally, Diraj, why is BMI important as a consideration for catheter ablation? You've talked about how it can increase the risk of developing AF, but does it actually influence the outcomes of a catheter ablation procedure?
Yes, so the two considerations when we offer patient catheter ablation are A, efficacy, how effective is the ablation going to be in this patient, but even more importantly, safety, how how risk of complications is going to be exposed, the patient is going to be exposed to. And having an adverse BMI tends to affect both of these considerations adversely. So many data have shown that if you have a significantly adverse BMI, certainly if the BMI is greater than 40, then not only are the success rates with cancer ablation less than what they should be, but also the risk of complications is much higher. And for that reason, many hospitals have an upper BMI upper cutoff of 40, above which they will not offer patients cancer ablation, and one can see why. So yes, including that information is extremely important. And when I am faced with a patient in my clinic who has an adverse BMI, I tell them that it is very much a partnership between you and me. I can do my bit, which is the catheter ablation, but that's a one-off. What's really going to help you over the medium to long term is your contribution. So let's look at this as a partnership. I'll do my bit, but please, can you do your bit first so that I know that you're committed to it while you're waiting on, on the waiting list. I want you to lose weight. And then I want to see that progress continue over the follow-up as well, because that's what's going to keep you out of atrial fibrillation in the future.
Fantastic, Diraj. I think we've covered all the primary care relevant aspects of AF very holistically, the management, and in particular, you've clarified this often confusing issue of who we in primary care should be referring for an assessment by an EP cardiologist. And you've clearly highlighted this paradigm shift in the evidence and guidance. So thank you so much for your wonderful expertise and sharing some real nuggets of practical advice to influence our clinical practice. I'd also like to thank you, the audience, for watching this video. I hope you find it a useful resource. And a reminder, if you would like a copy of the one-page referral pathway, I personally have it laminated and stuck on the wall in my clinic. Please go to the referring physician part of the Medtronic website. Thank you so much, Diraj, and hopefully see you all soon.